Your dentist isn't telling you the whole truth about what's happening to your teeth right now. And this silence could cost you thousands of dollars and years of pain. I'm about to reveal 5 dental problems that attack almost everyone over 50, and more importantly, the simple steps you can take today to protect yourself. Here's something that will shock you. By age 65, 1 in 5 Americans has lost all their teeth. Not some teeth. All of them. But here's the thing. This isn't inevitable. It's preventable. And the solutions are simpler than you think. Let me ask you something. When was the last time you really looked at your gums? Not just a quick glance in the mirror, but actually examined them? Because what's happening there right now could determine whether you keep your teeth for life or lose them in the next decade. Let's start with the biggest threat you're facing. Gum disease. And I'm not talking about the mild version you might have heard about. I'm talking about periodontal disease, the silent destroyer that affects nearly 70% of adults over 65. This isn't just about bleeding gums anymore. Here's how it works. The bacteria in your mouth form colonies along your gum line. These colonies create pockets between your teeth and gums. As these pockets deepen, the bacteria move further down, attacking the bone that holds your teeth in place. And here's the scary part. You might not feel any pain until it's too late. The bone loss happens slowly, quietly, invisibly. One day you're fine. The next day your tooth feels loose. By the time you notice, you might have already lost 30 to 40% of the supporting bone. That's when your dentist tells you the tooth can't be saved. But it didn't have to be this way. What can you do about it? First, upgrade your brushing technique. Most people brush too hard and too fast. You need to brush gently for 2 full minutes, twice a day. Use a soft bristled brush. Hold it at a 45-degree angle to your gums. Make small circular motions. Don't scrub back and forth like you're cleaning a floor. Second, floss every single day. I know you've heard this before. But here's why it matters more now. The spaces between your teeth are where gum disease starts. Your toothbrush can't reach there. Only floss can. If regular floss is difficult, try floss picks or a water flosser. The important thing is to clean between every tooth, every day. Third, see your dentist every 6 months for professional cleaning. Some people need to go every 3 or 4 months. Your hygienist can remove the hardened plaque that your brush can't touch. They can measure those gum pockets I mentioned. They can catch problems early, when they're still fixable. Now let's talk about the second major problem. Dry mouth. This might sound minor compared to gum disease, but it's actually a serious threat. Your saliva does more than keep your mouth wet. It neutralizes acids, washes away food particles, and fights bacteria. When you don't produce enough saliva, your teeth are under constant attack. Why does dry mouth happen as you age? Sometimes it's natural aging, but more often, it's caused by medications. Blood pressure pills, antidepressants, antihistamines, pain medications. These drugs reduce saliva production. If you're taking multiple medications, the effect multiplies. The consequences are severe. Without enough saliva, cavities form faster. Your gums become irritated. You might develop fungal infections. Your breath smells bad. Eating becomes uncomfortable. Speaking becomes difficult. And the damage accelerates quickly. What's the solution? Start by drinking more water. Sip throughout the day. Keep a water bottle with you always. Choose sugar-free gum to stimulate saliva production. Avoid alcohol-based mouthwashes, which make dryness worse. Use a humidifier in your bedroom at night. You can also try saliva substitutes available at pharmacies. These products coat your mouth and provide temporary relief. Some people benefit from prescription medications that stimulate saliva glands. Talk to your doctor about adjusting your medications if dry mouth is severe. Sometimes switching to a different drug can help. The third problem is tooth decay, but not where you expect it. As you age, your gums naturally recede. This exposes the roots of your teeth. Unlike the crown of your tooth, which has hard enamel protection, the root is covered only by softer cementum. This makes root cavities extremely common in older adults. Root cavities are particularly dangerous because they spread quickly. The softer material offers less resistance to decay. By the time you feel sensitivity or pain, the cavity might already be deep. If it reaches the nerve, you'll need a root canal or extraction. Prevention starts with fluoride. Use a fluoride toothpaste twice daily. Consider a fluoride mouth rinse as well. Your dentist might recommend prescription-strength fluoride treatments. These create a protective barrier on exposed roots. They can actually reverse very early decay. Limit sugary and acidic foods. Every time you eat sugar, bacteria produce acid for 20 minutes afterward. If you're constantly snacking, your teeth are under constant attack. Try to eat sweets only with meals, not between them. Rinse with water after eating. Wait 30 minutes before brushing, as brushing immediately after acidic foods can damage softened enamel. The fourth problem is tooth loss and its domino effect. When you lose even one tooth, the neighboring teeth start to shift. The tooth above or below the gap begins to drift. Your bite changes. This puts abnormal stress on other teeth, making them more likely to crack or loosen. The bone in the gap starts to shrink. One lost tooth often leads to more lost teeth. The solution is replacement. Don't leave gaps. Dental implants are the gold standard. They replace both the tooth and the root, preventing bone loss. They function like natural teeth. Yes, they're expensive. But they last decades and prevent future problems. Think of them as an investment in your health. If implants aren't an option, consider bridges or partial dentures. These restore function and prevent shifting. Modern dentures are much more comfortable and natural looking than older versions. Some are even supported by implants for better stability. The fifth and final problem is oral cancer. Your risk increases significantly after age 50. Oral cancer can appear on your tongue, lips, cheeks, floor of mouth, or throat. Early detection is crucial. When caught early, the 5-year survival rate is 84%. When caught late, it drops to 38%. What should you watch for? Red or white patches that don't heal. Sores that persist for more than 2 weeks. Lumps or thickening of tissues. Difficulty chewing or swallowing. Numbness in your mouth. Persistent sore throat. Changes in your voice. Your dentist should perform an oral cancer screening at every checkup. They'll examine all the soft tissues in your mouth. They'll feel for lumps. They'll look for suspicious changes. This screening takes just a few minutes but could save your life. You can reduce your risk. Don't smoke or use tobacco products. Limit alcohol consumption. Eat plenty of fruits and vegetables. Protect your lips from sun exposure with SPF lip balm. Practice good oral hygiene. See your dentist regularly. Here's something most people don't realize. Your oral health affects your entire body. Gum disease is linked to heart disease, diabetes, stroke, and Alzheimer's. The bacteria from your mouth can enter your bloodstream. They can cause inflammation throughout your body. Taking care of your teeth isn't vanity. It's essential health care. Let me give you an action plan you can start today. First, Schedule a dental appointment if you haven't been in the last 6 months. Be honest with your dentist about any concerns. Ask them to check specifically for the problems I've mentioned. Second, upgrade your oral hygiene routine tonight. Buy a soft bristled toothbrush or an electric toothbrush. Get fluoride toothpaste. Stock up on floss or floss picks. Set a timer for 2 minutes when you brush. Make it a habit. Third, evaluate your diet. Cut back on sugary snacks and drinks. Increase your water intake. Add more crunchy vegetables, which naturally clean your teeth. Consider taking a calcium and vitamin D supplement to support bone health. Fourth, review your medications with your doctor. Ask if any could be causing dry mouth. Discuss alternatives if needed. Don't stop taking prescribed medications without medical advice, but do have the conversation. Fifth, perform monthly self-exams. Look at your teeth and gums in good light. Feel for lumps or rough spots. Note any changes. Report concerns to your dentist promptly. Remember this. Every tooth you lose makes eating harder. It affects your nutrition. It changes your appearance. It impacts your confidence. But with proper care, you can keep your natural teeth for life. Millions of people do it. You can too. The problems I've described are common, but they're not inevitable. They're the result of neglect, not aging. Your teeth were designed to last a lifetime. Give them the care they need, and they will. Don't wait until you're in pain. Don't wait until teeth are loose. Don't wait until it's too late. Start protecting your teeth today. Your future self will thank you, because nothing tastes as good as keeping your own teeth feels.